something about Calcarea group, and hope you are preparing for your exams. Do well. And here's some key points about Calcarea group from Boric and Keynote Materia Medica. Okay, let's go into the topic. Calcarea acetate. So the medicine has been selected here is Calcarea acetate, then Calcarea arsenicosa, Calcarea carbonica, Calcarea fluorica, Calcarea iodata, Calcarea phosphorica, Calcarea sulfurica, and Calcarea silicata. So we will see one by one what is Calcarea acetate. So Calcarea acetica is common name is acetate of lime. It has a brilliant clinical result in inflammation of mucous membrane. So the Calcarea acetica has a sphere of action on mucous membrane and mainly in inflammation, and which is characterized by membranous exudation. So here the membranous exudation is an important point. We can note it down in Calcarea acetica. Otherwise, its action and application is like the carbonate, and it's palliate all the cancer pain also. Then vertigo in open air, there will be some sense of obscure while reading, and there is a megrim. Megrim is nothing but the severe vascular headache with the great coldness in head and sore taste. So these are few important points has been noted from Calcarea acetica. So there will be an inflammation mainly in mucous membrane, and which is characterized by or which is expressed by membranous exudation. Then there will be a sense of obscure while reading and megrim. Okay, these are the things. And next there will be a membranous dysmenorrhea, which is compared with borax. So in borax there will be a dread of downward motion in nearly all complaints, right? It's everyone, you know. Then there will be a profuse albuminous scratchy sensation as if warm water were flowing down for 2 weeks between the catamine. So there will be a membranous dysmenorrhea seen in Calcareum acetica, and in borax there will be a sensation of something is running like a warm water, and which comes down. That's occur between 2 weeks between the catamina, which means the menses. So that is the difference. Then there will be a rattling expiration. The cuff will be loose with expectoration of large pieces like a cast of bronchial tubes. So the cuff is so loose with the expectoration of large pieces like casts of bronchial tubes. So these are the, only 4 points are important in this. That is, the inflammation is characterized by membranous exudation seen in mucous membrane. Then there will be a sense of obscure while reading, and then that is a megrim, that is means the severe vascular headache. Then about the cuff will be loose with expectoration of large pieces like a cast of bronchial tubes. Then we are seeing the relationship, that is compared with bromium, borax, and also Calcarea oxalata in excruciating pain of open cancer. So as I said earlier, Calcarea acetate will palliate all type of cancer pain. So here that is compared with Calcareum oxalatum also. Okay. So that's all, Calcarea acetate, tica, and next remedy is Calcarea arsenicosa, which is a common name called by that is arsenate of lime, that is Calcarea arsenica. Here it's when thinking about the Calcarea arsenicosa, we have an idea that there is something sphere of action on the heart. Okay, so here is epilepsy with the rush of blood to the head before an attack, and this is an heart remedy with an epilepsy remedy also. So how the epilepsy will progress, that the epilepsy with the rush of blood to the head before the attack, and aura felt in the region of heart like a flying sensation. So this remedy is mainly for epilepsy and the heart. So the epilepsy with the rush of blood to the head before the attack, and aura is felt mainly in the region of heart, which is like a flying sensation. Then the patient will having the chronic malaria, complaints in fat humans around climacteric like graphitis sepia. Then infantile enlarged liver and spleen, nephritis with great sensitiveness in kidney region. So in nephritis condition, we can think that our Calcarea ars is one of the remedy. Then complaints of drunkards after abstaining, like carbon sulf, and then fleshy women at climacteric, aggravation, slightest emotion causing palpitation. So here is also the climacteric remedy for women, and who is suffering from or who is get aggravating from slightest emotion and which expressed as a palpitation. Then there will be a dyspnea with a feeble heart. Then chilliness will be there and albuminuria is there. So in this thing, only important points are Calcarea ars patient will having the nephritis with the great sensitiveness in the kidney region. Then fleshy women's at climacteric, which causes slightest emotion causing palpitation. Then there will be a chilliness with albuminuria. Then about the dropsy, this is also one of the remedy for dropsy. And the affection, main sphere of action is the affection of spleen and mesenteric gland. Hemoglobin and red blood corpuscles are low. So here the patient will having the affection of spleen and mesenteric glands, and the hemoglobin and RBC will be very low. And as I told, there is a great mental depression. The slightest emotion causes the palpitation of heart, which is compared with the lithium carb. Okay, lithium carb patient is also having the slightest that mental agitation and vexation, which is very subjected to trembling and fluttering. So whenever the Calcarea ars patient is having mental emotion, slightest mental emotion cause, they will go for palpitation of the heart. In case of lithium carb, the patient will go for vexation, which is characterized as very subject as a trembling and fluttering of heart, then distressingly painful in heart, and as far as between the shoulder upwards into the head, where it is felt as painful throbbing on inspiration. So these are the expression of lithium carb patient. It's mainly emotional cause which leads to palpitation of the heart. Here the vexation of the heart will leads to subject like trembling and fluttering of heart and distressing painful in heart as far as between the shoulder upwards into the head, where it is felt as painful throbbing, and mainly pain will be felt during inspiration. Then, as I told, the rush of blood to the head and the left chest, which is compared with amyl and glononine. In glononine, congestive headache will be there. Then any exertion brings on rushes of blood to the heart and fainting and spills. So in glononine, the patient will be having the faintingness and spills, and the complaint is expressed as the fainting and spills, and it's mainly congestive type of headache, which rush brings any exertion brings the rushes of blood to the heart. And then in amyl, here the flushing and other discomfort at climacteric and palpitation of heart similar with the this remedy. So here mainly giving for the in giving for the dilatation of arteries, okay, and capillaries. So while inhaling this drug, it rapidly dilates the arterioles and capillaries, producing flushy of heat and face and throbbing in the head. That is superficial arterial hyperemia, flushy and other discomfort at climacteric, palpitation of chest. So these are the complaint we can compare with amyl nitrosol. So mainly it causes a dilatation of all arterioles and capillaries, producing a flushing of heat, face and throbbing in the head. That's the main thing. Here the rush of blood to the head and left chest. Here is the throbbing and the flushing in the head. It's mainly occurring due to the dilates all the arterioles and capillaries at that time. Okay, then epilepsy from valvular disease of the heart. So any valvular disease which leads to epilepsy can think of Calcarea acetata. And then complaints of drunkards after abstaining, and then craving of alcohol, craving for alcohol. The other remedies, that is azaram rubrum, then sulfuric acid. And in azaram rubrum, there will be more of nervous affection, loss of energy with excess earthism, then scratchy on silk or linen paper is unbearable, and the desire of alcohol drinks and smoking, tobacco, tasters and fines. Here what means, the patient will taste the alcohol or smoking tobacco and they tend to be faint. That's the important symptom of azaram. And in sulfuric acid, there will be a marked debility, that especially in the GIT, very relaxed in stomach, and craving stimulate the tremor and weakness. When the patient is sulfuric acid and who is craving for alcohol, he will be very weak and his stomach will be very relaxed, and which create the tremor and weakness. So everything must be due in hurry. This is the main comparison of the azaram and the sulfuric acid in case of craving for alcohol. So in craving for alcohol, it's mainly smoking and tobacco causes faint taste. Tobacco taste causes faintness in azaram, and in sulfuric, patient will be feeling like a relaxed stomach, and the stimulant, the craving for the stimulant causes the weakness and tremor and everything. So they do everything in a hurry. That's the thing. Then violent rush of blood to the head with vertigo, pain in head, better by lying on painful side. So here the modality is ameliorated by lying, pain in head ameliorated by lying on left side. It's a weekly headache, okay. Benumbing headache mostly around ears. Then kidney regions is sensitive to pressure. Albuminuria, passes urine every hour. So as I already told, there is a nephritis. So kidney region is so sensitive to pressure, and there will be a albuminuria, which is passes urine every hour, and there will be a palpitation, that constriction and pain in the region of chest, suffocative feeling and palpitation, oppression and throbbing, and pain in back extending to arms. This is the main symptom. Then modalities, it was from slightest exertion, as we know, it's cause and slight emotion disturbance leads to palpitation. So the slightest exertion, whether it is mental or physical, it get aggravated by the patient. And the relation, it's compared with conium, gluonium, lithium, pulsatile and axomica. It follows well after conium in lymphatic or psoric or tubercular persons. As I told, there is an involvement of mesenteric and mesenteric glands. So it is in the glandular affection, it follows after conium. Mainly in the miasmatic background, we can see psoric or tubercular persons. So next topic about the Calcarea ostreum. That is the middle layer of oyster shell or calcium carbonate. And this is the very known polycrust remedy. Everyone may be thorough of it. So just have a glance of it. It has a disposed to grow fat. So Calcarea is a tendency who is having fat, that is grow easily as a fat person. So this is then corpulent and unwieldy. Children with red face, flabby muscle, who sweats easily and take cold readily in consequence. Head sweats profusely while sleeping, wetting pillow for around. So here the head sweats will be more profuse, aggravation while sleeping, and it will wet the pillow for around. Similar thing can be noted in Silesia and Sanicula. In Silesia, profuse sweat of head, offensiveness extends to nape of neck. Here, the Calcarea carpet patient will having only profuse sweat while sleeping and wetting pillow for around. But Silesia patient will have profuse sweat of head, which is offensive and extends to nape of neck. And in Sanicula, profuse sweat on occiput and nape of neck, aggravation during sleeping. So more or less symptoms are similar, but Silesia will having the profuse sweat mainly in the nape of neck with an offensiveness. That is the differentiating point, and the sanicula is also having a profuse sweat on occiput. In Silesia, this will be having sweat is more on nape of neck, and in sanicula, it will be more on occiput and the nape of neck, which is also aggravation like during sleep, like calcarea carb. So these are the symptoms. So the main point is who is disposed to grow fat and take cold readily in consequence, then head sweat profusely while sleeping and wetting pillow for around, then profuse perspiration mostly on back of head and neck or chest or the upper part of the body. So this comes is again compared with Silesia, as I told earlier. Then acidity of digestive tract, sore irritation, sore vomiting, sore stool, or sore odor of the whole body. So soreness is running throughout the drug, and there will be a acidity of digestive tracts. This is combined with hepar and rheum. In rheum, there is a sore smelling of the whole body. Child smells sore even after washing or bathing. So what rheum children means? The children is sore very badly even after washing or bathing also. Okay, and then in HEPA self, the soreness will be seen in mainly in the stool. Okay, stool is sore while undigested and loss of power to expel even a soft stool. Then about the sweat, profuse sweat at day and night without relief. Perspiration is sore, offensive, easily on every mental or physical exercise. So in HEPA self, so sore will be seen in two areas, that is on one is on stool, another one is on the perspiration. These are the main differentiation between the HEPA self and RAIN. Then girls who are fleshy, plethoric, and grow too rapidly. Okay, then the girls, it is mainly suitable for girls who grow too rapidly. They are fleshy and plethoric. Then menstruation is too early, too profuse, too long lasting with subsequent amenorrhea and the chlorosis with menses scanty or suppressed. Here we'll have all the type of menstrual disorder, whether it is too early or too profuse, too long lasting with subsequent amenorrhea. The patient will have continuous problem in menses, like too early menses, too profuse menses, too long lasting menses. After that, it comes into like an amenorrhea and chlorosis with the menses candy or suppressed. We can see the two phases of calcarea in this female menstrual. Then women menses too early, too profuse, feet habitually cold and damp, as if they have had and cold damp stocking, continually cold in bed, and the least mental excitements cause profuse return of menstrual flow. So any least mental excitement will leads to the menses flow. Okay. That's the important thing, and which is compared with sulfur and tuberculinum. In sulfur, menses is too early, too late, too short, scanty, and profuse protracted menorrhagia has not been well since here last miscarriage. A single at new thick black acrid making part sore. So here is the in sulfur, the menses is like calcarea card. This is also too early, too profuse. The protracted menorrhagia has not been seen well since here in last miscarriage. Okay, it's said by a single at new moon. Mainly it's said by Lippi. So this is another important keynote point. Please make a note of it, or you can check it with keynote. And another side, the sulfur patient is also having too late, short, scanty menses also. And then another thing, the menses will be thick, black, acrid, and making part very sore. So these are the symptoms of sulfur. Then about in tuberculinum, menses is proceeding headache or stopped suddenly. In tuberculinum, mainly the menses presided by headache. Menses will start with the headache, and once the headache will stop when the flow comes. Okay, then there will be a benign tumor. Menses too early, too profuse by lasting, and pain increases with establishment of flow. And the patient will having the dysmenorrhea with how the bleeding will be, or the how the menses will, it depends on both. So it's vice versa. And there will be too early and too profuse long lasting menses also there. So these are the symptoms compared with sulfur and tuberculinum. In a nutshell, that is, sulfur will having both extremes of menses, that too late, profuse, short, scanty flow. But only thing is, but menorrhagia has not been well since her last miscarriage. This said by a single at new moon, is said by Lippi. And then in tuberculinum, menses presided by headache or stop suddenly. Benign mammary tumor. Then fear she will lose her reason, or that people will observe her mental confusion. That is like actia spicata. Here, sensation as if heavy black cloud settled all over the face, envelop the headache, that all its darkness and confusion. So here is also she will having that mental confusion, but only as the sense of sensation. Like she is having a sensation as if having cold, heavy black cloud settled all over her and enveloped her head, so that all that darkness and confusion will be appear. With that sensation, she is coming into a conclusion that everything seems to be confusion. But in case of Calcarea, it's the mental confusion will be observed by others. That is the fear, one of the main fear we can see here. Then not all the Calcarea carps are disposed to grow fat. There are some exceptional case. The lung disease of tall, slender, rapidly growing youth, upper third of right lung, often guide to the constitutional remedy than phosphorus. Okay. So in Calcarea also, the person with tall and slender who is rapidly growing maybe comes under the Calcarea carp also than phosphorus. Okay, that's the main thing. Then in sulfur, it is, that is, ours is mainly affection on the upper left, and then sulfur is much rattling in mucus, oppression as a load on chest, dyspnea, pulses more rapid, and in tuberculinum, that is when compared with the constitution remedy, in tuberculinum, difficulty in respiration in many, wants to window, pleuritic exudation and open, then enlarged tonsils of undisturbed value in the treatment of incipient tuberculosis. So in phosphorus and tuberculosis is also a tall, slender persons. So that we need to differentiate, and we can find the correct simillimum if the Calcarea carp patient is also affected with the lung disease. So we once then in so you have to think that not all the Calcarea carps are fat and flabby. Some of them are with tall and slender, who is having mainly affection towards the lung disease. Then disease arising from the defective assimilation and imperfect ossification. Because of these things, patients feel difficult in learning to walk or stand. Children have no disposition to walk or will not try, and suppressed sweat. And defective assimilation and imperfect ossification is another important point in this. And the rawness of sole feet from perspiration, blisters, and offensive food sweat. And this is compared with graphitis and sanicula. In graphitis, offensive perspiration of feet is alone there, and then in sanicula, offensive food sweat, which is cold, clammy, and sweat of extremities is mainly seen. So both are in graphitis, offensive perspiration seen only in feet, and in sanicula, offensive food sweat, that is, which is characterized by cold, clammy sweat of extremities. So longing for fresh air when in room, which inspire and benefit strengthens, like pulsatilla. Pulsatilla patient seeks open air always, and which feels better them. And in sulfur, that is difficult respiration, wants the windows to open. So sulfur patient wants the windows to open because of the difficult respiration, and pulsatilla patient will always craves for the open air, and which gives some sort of relief to them. Okay. And here, which inspire the longing for fresh air when in room. It's when the patient is in the room, the Calcarea patient is when the room, it's they are longing for the fresh air, which inspires and benefits and strengthens. Then coldness of general single parts, that is calica, which is sensitive to very cold to all things. So general coldness general of single parts like headache, stomach, abdomen, feet, legs, and aversion to cold, open air, goes right through her, sensitive to cold, damp, great liability to take cold, then which is directly opposite to sulfur. Sulfur patient wants everything in warm. Sorry, everything in cold. Okay. And the sweat of single parts, head, scalp, wet and cold, nape of neck, chest, axilla, and sexual organs, hands and knees and feet. These are the sweats of Calcarea carp. In sepia, this is hyperhidrosis in brain disorders. Then sweat on feet, worse on toes, intolerable order, lentigo in young ectosis with offensiveness order of skin. So in sepia is also having hyperhidrosis, and in brain disorders, sweat on feet is more, then worse on toes. Mainly toes will be more sweat, and intolerable order is also there, like silicea. Then lentigo in young ectosis with offensiveness order of skin. That's the important symptom of sepia. Important comparing symptom. Then pit of stomach swollen like an inverted saucer and painful to pressure, uremic or other disease brought on by the standing on cold damp pavement or working while standing in a cold water, and modulus of works or in cold clay. Feels better every way when constipated. Stool has to be removed mechanically. So the Calcarea carp patient will be always better when constipated, and it will not affect their routine at all. So it is compared with aloes, sanicula, sepia, silicea, and selenium. In aloes, there is a constant bearing down with bleeding of sore and heart, ameliorated by cold, and sense of insecurity in rectum. Uncertain whether gas or stool will come. Stool passes without effort, almost unnoticed. Lumpy, watery stool. So here the patient will having that, no, they are not aware whether that stool is passed or gas is passed. There will be a lumpy watery stool, and then they are very uncertain about the stool will come, stool or gas will come. That's the important thing. And stool passes without effort, almost unnoticed. That is the comparison thing. And then constant bearing down, bleeding, sore and heart, ameliorated by cold. In then sanicula, there is no desire until a large accumulation of water and great staining will partially expel, reduced, and crumbles at wedge of anus. Very offensive order, pain in whole perineum. So there will be no desire until there is a large accumulation. In sanicula, after great staining, only partially expelled. So they need to strain more for the partial expulsion, and result grumbles at the wedge of anus. There will be something they feel that is crumbled in the wedges of anus, and which is very sensitive, offensive in order, and pain in whole perineum. Then in sepia, the stool is very soft stool and difficulties in constipation, large hard stool, feeling of a ball in rectum. In sanicula, there is something is research and grumbles at the wedge of anus, and in here it's something feeling like a ball, feeling of ball in rectum, cannot strain with great tenesmus and pain in shooting upward. So there is a pain in whole perineum. Here the tenesmus and pain shooting upward. In selenium, stool is constipated, hard and accumulated in rectum. Okay, here is hard and accumulated in rectum, mainly seen in liver affection. And in silicea, with the liver affection with enlarged liver and rashes over that region. In silicea, there is a constipation always before and during menses. Stool comes down with difficulty, which partially explains. In silicea, stool will come partially, and it will resides again, and it's mainly before and during menses. Constipation can be mainly seen in before and during menses. So these are the differentiating points of aloe, sanicula, silicea, selenium, and sepia and remedies. Then painless hoarseness aggravation in the morning decide to be magnetized, like phosphorus. For the phosphorus is a remedy which also good to make friends and wants to be with everyone. So this is a great Hahnemannian antisoric as a constitutional remedies par excellence. Its chief action is centered in vegetative sphere, impaired nutrition being the keynote of its action, the glands, skin, bones, and being instrumental in change word. Increased local and general perspiration, swelling of glands, scapulars, and rheumatic condition generally offers numerous opportunities for exhibition of calcarea. So these are the things taken from keynote. You need to, for these types of examination, you should memorize the keynote as possible. So incipient thesis that can be compared with arsenicum album, arsenic iodatum, ars iodatum and tuberculinum. Incipient thesis is mainly in tuberculinum is undoubtful value in the treatment of incipient thesis, especially adapted to light complex narrow-chested persons. When the constitution is indicated, we can think of tuberculinum. In the arsiode, acute affection, respiratory organs, pneumonia, and the rapid extensions, then unable to lie down with the fear of suffocation. Mainly in the upper third right lung has been affected. It covers the tickling cough, feetling, and chest pain, nausea, acidity, and dislike of fat. Get outs of breath easily. A jagged state, mental or physical, due to overwork, abscesses in deep muscle, polyp and extosis, pituitary and thyroid dysfunction. For all the pituitary and thyroid dysfunction, we can think of calcarea, and then jagged state of mental or physical due to work, and there will be an abscess in the deep muscle, polyp or extosis. It gets out of breath easily. Raised blood coagulability, it's defined to stimulate the periosteum. Then it's just homostasis and give this power probably to the gelatin injections. It's similar to the gelatin injection. And then easy replace, relapse and interrupted and convalescence. Persons of scapulous type who takes cold easily with increased mucus secretion. Children who grow fat or large, built with large head, pale skin, chalky look, so-called leukoplagmatic temperament. Affection is caused by working in water. Great sensitiveness to the cold, partial sweats, and children craves eggs and eat drit and other indigestible things or prone to diarrhea. Calcarea patient is fat, fair, flabby, and perspiring, cold, damp, and sore. Apprehensive towards evening, fierce loss of reason, misfortunate, contagious disease, forgetfulness, confused, and spirited. Icy coldness in and on the head, especially right side, open fontanelles, largest head, much perspiration, wets the pillow. Spot and ulcers on the cornea, chronic dilatation of the pupil. So these are the what are the things has been mentioned in colors. Please make a note of it and try to remember things. Deafness from working in water, polyp which bleed very easily, scapulous inflammation with mucopurulent notaria and enlarged glands, perversions of hearing, hardness of hearing. Then all the eruptions on behind the ear. So here it is compared with the petroleum. Here there will be an nose is unbearable, especially from the several people talking together. That is, patient cannot able to unbearable that so many people are talking together, and then there will be an eczema will be there. Mainly it's behind the ears. This is eruption on and behind the ear. Here it's only behind the ears with the intense itching. There will be more itching seen in petroleum. Then dry nostrils, sore and ulcerated, stoppage of nose, also with fetid yellow discharge, offensive odor in noise, polypi, swelling at root of nose, epistaxis, coryza, takes cold at every change of weather, and persistent sore taste. Then swelling of tonsil, goiter, aversion to meat, boiled things, craving for indigestible things, sharp, cold pencil, also eggs, salts, and sweets. The craving and aversion is very strong. Aversion to meat and boiled things. Then craving for indigestible things, chalk, coal, pencil, also for egg, salt, and sweet. Milk, it's very disagree to them. Frequent sore irritation, sore vomiting. Dislike of fat, loss of appetite when overwork. Thirst is longing for cold drinks, aggravated while eating, hypercholadria. Then inguinal and mesenteric glands are swollen and painful, cannot bear tight clothing around the waist, distension with hardness, mainly seen in gallstone colic, gargling and constriction in rectum. Stool is large, hard, whitish, watery, and sore. Then children's diarrhea, constipation, stool at first hard. Then frequent emission with increased desire. Semen is emitted too soon, and coition is followed by weakness and irritability. Menses will be too early, too profuse, too long, with vertigo and toothache. And cold, damp feet with the least excitements cause their return. Uterus is easily displaced, leucorrhea, milky, which is compared with sepia. So here the Calcarea carb has the two phases of menses, that is too early, too profuse, too long lasting, and each and every least mental excitement will causes the flow. And uterus is easily displaced. Leucorrhea is milky and mainly in children. So that's all about the Calcarea carb. The next remedy is a few more things also there that we can find in the boric and keynote. I'm just reading it out. You just go through and make a point of it. Persistent irritating cough from the arsenical wall, which is said by Clark. Then extreme dyspnea, painless hoarseness, worse in the morning, expectoration only during the day, thick yellow sore mucus, bloody expectoration with a sore sensation in the chest. Suffocation, spills, tightness, burning, and soreness in the chest. There will be a more suffocating spells and tightness, burning, soreness in the chest. Worse when going upstairs and or the slightest ascent must sit down. Sharp pain in the chest from before backwards. Then chest is very sensitive to touch, percussions or pressure. During an examination, patient chest is very sensitive to touch. Then longing for fresh air, scandy, salty expectoration like lycopodium. Lycopodium, everything tastes sore, which is an untreated, neglected, or pneumonia. Maltreated pneumonia, which is mainly seen in the base of the right lung. Then cold, damp feet feel as if damp stocking were worn. Soles of feet is raw. Feet feel cold, dead at night. Cold, old sprains, tearing in muscles. Some disagreeable ideas always arose from light slumber. Then night terrors, which is seen in Calcarea foss also. Here it's no asthma. So as while during an asthma, there is the even the least food intake will also shorten the breath. That's the night tremor is compared here. Then dreams of the dead. Fever chill at 2 p.m. begins internally in stomach region. Fever with sweat, pulse full and frequent, chillness and heat, partial sweat, night sweat, especially on head, neck, and chest. Hectic fever, heat at night during menstruation with restless sleep. Then a sweat overhead in children so that pillow became wet. Pectineal eruption, worse from exertion, mental or physical, ascending and cold in every form, water, washing, moisture, wet weather during full moon, and standing. Better dry climate weather, lying on painful stay. Sneezing, pain in head and nape of neck. Relation antidote is compared with ipecac, nitric acid, and axomica. Complementary belladonna, rustox, lycopus, is useful after sulfur, where there is the pupils remain dilated. When pulsatilla is failed in schoolgirls. So this is an important thing. Calcarea will not be if useful after sulfur. If you are giving sulfur, then you can think of calcarea, where the pupils remains dilated, and pulsatilla failing. When the pulsatilla is failing schoolgirls, we can think of calcarea. Incompatible bri, sulfur should not be given after calcarea. There should be an order for giving calcarea, lipo, and sulfur. After giving calcarea, you should not give sulfur directly. Into middle of it, you should give, if you want to give sulfur, then you have to give a dose of lycopodium, and then you have start the sulfur. And it's compare, it's aqua. This is nothing but for your understanding. I just taken, just you go through at the last moment. This is the relationship chapter, which is mentioned in the boric. I just you go through this, so that we can found the different types of calcarea, like calcarea calcitaniad. It's mainly the calcarea calcinide oyster shell is a remedy for warts. And then calcarea ova tosta is the eggshell. It's mainly good for backache and leukorrhea, feeling as if back were broken into, tired feeling. Then also effective in controlling suffering from cancer. Then calcarea lactic, that is anemia, hemophilia, urticaria, where the coagulability of the blood is diminished, and nervous headache with the edema of eyelids, lips, or hands. And then calcarea lactofos, which is good for cyclic vomiting and migraine. Then calcarea brome, which is remove the inflammatory products from the uterus. Children lacks fiber, nervous irritability with gastric and cerebral irritation. Then tendency to brain disease, then insomnia and cerebral congestion. And sulfur is differs in being worse by heat, hot, and feet, etc. So these are the some important things we can find in the calcarea carb relationship chapter. Please go through it. It will help you to understand clinically what is calcarea. Then again, this is another thing like calcarea mur and calcarea chloratum. It is given for all pregocapitosis, boils, and vomiting of all food and drink with gastric pain, impetigo, then glandular swelling, angioneurotic edema, pleurisy, and effusion, and infant eczema in infants. Then calcarea picreta. This is also free follicular inflammation, a remedy of prime importance recurring chronic boils. Picreta is an important remedy for chronic boils, particularly when located on the parts thinly covered with muscle tissue, as in shin bones, coccyx, then auditory canal, dry scarf accumulation, exfoliation, okay, in that area. Then compare it with calcarea, lycos, silicea, pulsatilla, and chamomilla. So next is the relation complementary to belladonna, which is an acute of calcarea. Belladonna is an acute of calcarea. Calcarea is acts before lyco, yes, naxomica, phosphorus, silicea, and it follows well nitric acid, pulsatilla, sulfur. Especially if pupils are dilated. This word is coming again and again, especially if the pupils are dilated. And it is followed by calipican, nasal catara. According to Hahnemann, calcarea must not be used before nitric acid and sulfur. It may produce unnecessary complications. So these are the important points. You make a note of it. According to Hahnemann, calcarea must not be used before nitric acid and sulfur. It may produce complication. So in children, it may be often repeated. In aged person should not be repeated, especially first dose is in benefit. So it can be only repeated in children, not for the aged person. And Hahnemann said it is not advisable to give before nitric acid and sulfur, and it is follows well nitric acid, pulsatilla, and sulfur, especially if the pupils are dilated. It is followed by calipican, nasal catara also, and then complementary, it's belladonna. complementary and acute is belladonna. So next remedy is Calcarea florica. So it's a powerful tissue remedy for heart, stony glands, and varicose vein, and enlarged vein, and malnutrition of bone, hard knots in female breast, goiter, congenital hereditary syphilis, induration, threatened separation. See, these are all the important points. Make a note of it. These are the, if you find these words in somewhere in your question paper or something, you can close your eyes and you can write that is a Calcarea florica. Many cases of a Calcarea have undoubtedly been influenced and favorable by it. Congenital syphilis manifesting itself in an ulcerating of mouth, throat, caries, necrosis with boring pains and heat in parts. So congenital syphilis will be itself is manifestation at ulcers in mouth, throat, caries, necrosis with boring pain and heat in parts. Then there will be arteriosclerosis, threatened epilepsy, tuberculosis used after operation. The tendency to adhesions is reduced. So it's mainly used for the tendency to reduce the adhesion mainly after operation. Then stromosis filectromular keratosis, then subcutaneous papular cyst, chronic suppression of middle ear, vomiting of infants, vomiting of undigested food, then hiccough, then flatulence. In hiccough, it will be compared with cachputum and sulfuric acid. Hiccough on slightest provocation is seen in the cachputum, sulfuric acid, hiccough with the craving for alcohol. Weakness and faintness of appetite, nausea and distress after eating in young children who overtaxed by studies, acute indigestion from fatigue and brain fag, and much flatulence. The person who tends to have weakness and faintness in young children who study more. So we can think of Calcarea flu, then acute indigestion from fatigue and brain fag and much flatulence. Then hoarseness, croup, cough with expectoration of tiny lumps of yellow mucus with the tinkling sensation and irritation only lying down, spasmodic cough, and Calcarea flu removes the fibro deposit of the endocardium and restore the normal endocardium structure. If there is any problem in the endocardium, that is, there is any fibrous deposition, that Calcarea fluids can be helped to remove that endocardial structure. So remove that fibrous deposit in the endocardial structure and bring it back. Then chief remedy for vascular tumor with dilated vessel and for enlarged varicose vein, aneurysm, valvular disease when tuberculosis toxins attack the heart and blood vessels. Chronic lumbago aggravated on being to move like rustox and ameliorated on continuous motion, osseous tumor, richetic and enlargement of the femur in the infants, pain in lower part of the back with burning, marked whiteness of skin, scar tissue, adhesion after operation. Then chaps and cracks, fissure or cracks in the palms of hands or hard skin, fissure of the anus, separation with callus and hard edges and whittling. Intolerant fistula, ulcer scarring and yellow pus, hard elevated edges of ulcer surrounding skin, purple swollen, hard kernels and hardened glands in the female breast, swelling or indurated enlargement having their seat in the fascia and capsular ligament of the joint or in the tendon, induration of stony hardness. And the modalities was during rest and change of weather, better heat and warm application. Relation compare with conium, lapis, barretta, moor and Hecla rustox, and then in tumor they can be compared with cocktail of soda. Then Calcarea sulfur has an homeostatic obstructive uterine myoma, magnifera indica in varicose vein. A chronic remedy needs some time before manifesting its effect. It should not be repeated too frequently. It should not be repeated too frequently. It's a chronic remedy. Next remedy is Calcarea iodata. So it is in the treatment of scrofulous affection, especially enlarged glands, tonsils, and this is the remedy has gained marked beneficial result, and in thyroid enlargement about the puberty, fat flabby subject to cold. This is another common polycrust remedy can be seen in nowadays. It is a treatment of scrofulous affection, especially their glands will be more large and tonsils are enlarged, and this remedy has a beneficial effort for the enlarged glands and enlarged tonsils, and thyroid enlargement is about at the time of puberty. Then deaf children will be more flat and flabby and who subject to cold easily. Secretion is inclined to be profuse and yellow. Adenoids and uterine fibroids and chronic group, pain in chest, difficult breathing after syphilis or mercilization. That is mainly syphilitic miasm is involved. Then hectic fever, green purulent expectoration, croup, pneumonia, intolerant ulcer, and combining with varicose vein. So patient with intolerant ulcer and varicose vein, we can think of Calcarea iodata, and the patient with the croup or pneumonia, hectic fever can also think of Calcarea iodata. Easy perspiration, copper color, papillary eruption in tinea. Wherever there is the copper color papillary eruption is seen, we can think of Calcarea iodata, mainly in the tinea, favors, crusta, lacta, swelling of glands, the skin cracked, falling out of fat. It's compared with agraphis. Then here sulfur iode follows both agraphis and Calcarea iode, and aconite also compared with Calcarea fluors, silicea, and merc iodata. So next remedy is Calcarea phosphorica, that is phosphate of lime or calcium phosphate. This is for the person of anemic and dark complexion, dark hair and eyes, thin spare subject instead of fat. So Calcarea carp patient is so fat and flabby except the lung disease person. But in Calcarea phos, the person is that is fat and flabby. Here the person for anemic and they will be more dark complexed, dark hair, dark eyes, thin spare instead of fat. During the first and second rendition of the scrofulous children, diarrhea and great flatulence. The persons with the child with first and second rendition who is get more affection of prone to get more affection of diarrhea and great flatulence. Children is emaciated, unable to stand, slow in learning to walk, like Calcarea and silicea, because Calcarea has that is imperfect assimilation. That is the reason. And in silicea, it's also similar thing will be there. So then oozing of bloody fluid from the navel of infants of urine, that is compared with hyoscyamus. Then richetis corneal bole, thin and brittle, and fontanelles and sutures are remain opens. Spine is weak, disposed to curvature, especially to the left, unable to support the body. Neck weak, unable to support the head. That is compared with abrotanum. Neck is so weak, cannot hold up. Back is lame, weak, painful, pain in lumbar region, extend always to the spermatic cord, and pain in sacrum. So now mainly the neck of the abrotanum is so weak, cannot hold up. And here is also the unable to support the head. There is the unable to hold the head, and here is unable to support the head. This can be seen in phosphorus because of spinous affection and the disposition to curvature, mainly to the left, unable to support the body, neck weak, unable to support the head also. Girls at puberty, tall, grow rapidly, tendency of bone and soften or to spine to curvature. So girls who grow fast, tall and growing rapidly, tendency for bone affection. In pteridion, there is the sensitiveness between vertebra and avoid pressure on spine, stinking the pain. Here mainly spine to curvature. Spine to curve. Tendency of bone to soften or spine to curve. To seen in tall and growing rapidly individual. At puberty, acne in anemic girls with vertex head and flatulent dyspepsia, ameliorated by eating. Ailments from grief, disappointed love. Then female feels complaints more when thinking about them. So these ailment factor is compared with aurum ignitia, phosphoric acid. In aurum metallicum, ailment after fright, anger, contradiction, mortification, vexation, or dread or reserved displeasure. In ignitia, persons mentally and physically exhausted by long concentrated grief, an ailment from anger, grief, or disappointed love. In phosphoric acid, ailment after care, chagrin, grief, sorrow, and homesickness, they will be mild, yielding disposition, listless, apathetic, indifferent to affair of life, and prostrated and stupefied grief. So these are the difference. And then oxalic acid, thinking of the complaints aggravate them, like this one. And Helonius, profound melancholic patient is better when keep busy with mind engaged when doing something. So they are better only by doing something, and they always want keep themselves engaged. Then oxalic acid, thinking of complaints aggravated. Then involuntary sinking, that involuntary sinking with the, it can be seen in an ignition also, the involuntary sinking with a weak empty feeling at a pit of stomach, not ameliorated by eating. Only involuntary singing at compared at the level of GIT in ignitia, and which is not ameliorated by eating. Non-union of bones and promotes the callus, that is compared with symphytum. Wounds are penetrating to perineum and bones, and its non-union fracture, irritable stream after amputation, dilatation, and intake of base at point of fracture. So as everyone, it's a non-union of fracture bone, and here it's a non-union of bone, promotes callus. Here in Calcarea foss, it promotes the callus formation. Here it's help the non-union of bone, which penetrated to perineum and the periosteum on the bones. Then rheumatism of cold weather, getting well in spring and returning in autumn. Headache of schoolgirls, mainly seen in atramute. Atramute, the girls' headache will be seen more in schoolgirls who is of anemic in nature. And then sorinum, headache always aggravated when hungry and ameliorated while eating, preceded by flickering before eyes and the dimness of vision. So these are the things. And the schoolgirls, headache of schoolgirls with diarrhea can also be seen in sorinum. In atramute, anemia with the headache of schoolgirl. In sorinum, whenever patient feel hunger, patient will develop a headache and ameliorated by eating. Every attempt to eat, colicky pains in abdomen. Fistula in ano, alternating with chest. Beriberi, the lack of, compared with the beriberi, lack of animal heat, cold sweat, general coldness of the body. So in beriberi, there is a bilious colic followed by jaundice, stool, fistula in ano. So there will be more beriberi, there will be more of bilious colic with the jaundice affected by, followed by jaundice. One of the most important tissue remedy, and it will has many symptoms in common with Calcarea carb, and there is some different character feature of its own. Mostly it's similar to that of Calcarea carb only, but only few things are different that we will be seeing already. And further points are, it is specially indicated to dirty dentition and trouble incident that period, bone disease, non-union of fractured bones, and anemias after acute disease and chronic wasting disease. So it's mainly like Calcarea carb. It's mainly as I told, there is a dentition in the dentition problem, which lead to GI complaint. So that is the main trouble over here also. And the bone disease, which is non-union of fractured bones, and anemias after the acute disease, and some chronic wasting disease also. So it's indicated that ready indication and trouble incident that period, and then bone disease of non-union of fractured bones, and then mainly anemia after acute disease or some chronic disease. Anemic children who are peevish, flabby, have cold extremity and feeble digestion. It has a special affinity where bone forms a sutures of symphysis, and all its symptoms are worse from any change of weather. Numbness and craving are the characteristic sensation, and the tentative perspiration and enlarged gland glandular enlargement, and symptoms share with carbons, scopherless, corlysis, and thesis. So affinity where the bone and switches of symphysis are aggravated by the change of weather. Such complaints are aggravated by the change of any weather, then there will be a numbness and crawling will be there. Who is having the numbness and crawling, and the person who is tendency to perspire more with enlarged glandular involvement, we can think of calcarea phos like calcarea carb. Only the constitution difference will be there. They are very peevish, forgetful after grief or vexation. It is compared with ignitia and phosphoric acid. Always in ignitia, bad effect of anger, grief, disappointed love, broods in solitude over the imaginary trouble, desire to be alone. This is the think of ignitia. And then phosphoric acid originally loses vital fluid, sexual excess, violent old jargon or long session of moral emotions as grief, care, disappointed affection. So they will, in phosphoric acid, the patient will be think of the moral emotion of grief and disappointed affection, and there will be a loss of vital fluids also, and there will be a sexual excitement. In ignitia, the patient is having a bad effect of anger, grief. They will be thinking of imaginary trouble and broods over it and decide to be alone. So here is the peevish, forgetful after grief and vexation. Always wants to go somewhere. Headache was near the region of switcher from the change of weather. So every change of weather is sensitive to calcarea phos and also calcarea carb. Mainly its headache is mainly with the school going children about to puberty. And same similar thing is seen in calcarea carb also. Fondlens remains open too long. Cranial bones are soft and thin. Defective hearing, headache with abdominal flatulence, or head hot with a smarting root of hairs. Adenoid growth, craving for bacon, ham, salted and smoked meat. So craving for bacon, ham and salt smoked meats have been seen in calcarea phos with much flatulence. At every attempt to eat, colicky pain in abdomen, shrunken flabby, colicky soreness and bringing around the navel. Bleeding after hard stool. So only there will be a bleeding after very hard stool, diarrhea from juicy fruits, cider, and during dentition, green and slimy, hot, spewing, undigested with fetid flats, fistula in ano alternating with chest symptom. So make a note of this, compare these symptoms that which have been mentioned in a color, and try to understand and learn. There will be a green, slimy, hot, spewing, undigested with fetid flatus. That is an important thing. Hot with fetid flatus. Then at every attempt to eat, colicky pain in abdomen. Whenever they tend to eat, there will be a colicky pain. And then craving for smoked meat, salt, ham, and bacon. Then there will be an adenoid growth also. Menses too early, excessive, bright in girls. If late, blood is dark. Its menses is too early, excessive. If it occurred early, the color of the blood is bright. And if it is late, it is somewhat dark. Sometimes first bright and then dark with violent backache. During the lactation with sexual excitement. Nymphomania with aching, pressing, weakness in the ureterian region. It's compared with platina. In platina, the nymphomania is aggravation in lying women. Then during lactation, the sexual excitement. After a long period, after prolonged nursing, leukorrhea is like a white of egg. Worse aggravation morning. Worse from morning. Child refused breast milk tastes salty. Because it stayed salty, prolapses in debilitated persons. Then rheumatic pain from draught of air with stiffness and dullness of head. Soreness in sacroiliac symphysis as if broken. Stiffness and pain with cold, numb feeling, worse any change of weather. So stiffness will be there, pain with cold, numb feeling with any change of weather. So all the calcarea groups are very sensitive to change of weather. Crawling and coldness, buttocks, back and limbs asleep. pain in joints and bones, weary when going upwards. Aggravation, exposure to damp, cold, changeable weather, east winds, and melting snow, mental exertion. Amelioration, only summer, warm, dry atmosphere. So the calcarea first is sensitive to all types of cold weather, and only they get ameliorated in summer, warm and dry atmosphere. Relation, it's complementary to ruta, similar to Carbo animalis, calcarea fluor, calcarea and fluoric acid, calcarea califos, and then sorinum in debility remaining after acute disease. In case of, there is also, we have seen that no anemia after acute or chronic disease. So in that area, we can think of sorinum also. To silesia, but sweat of head is wanting, acts before iodata. So it will be act before iodata, sorinum, sanicula, sulfur, and it act after arsenicum, iodum, and tuberculinum. So if you find the person with the constitution of calcarea carp, give them a dose of intercurrent as a tuberculinum, and then start the case with calcarea phos. Compare calcarea hypophosphorosa. It is preferred when it seems necessary to furnish the organism with liable dose phosphorus in consequent continued abscess having reduced the vitality. Any abscess which continues and reduce the vitality, we can think of calcarea hypophosphorosa. And then diarrhea and cough, acute pain in chest, mesenteric tuberculosis in first and second decimal trials with the loss of appetite. And this is a note taken from the relationship chapter of calcarea phos in boric. Please go through it and make a note of it. This is also bleeding from lungs and angina pectoris, asthma, affection of arteries, veins stand out like whipcords, attacks of pain occurring every 2 hours after meal. Calcarea renalis is an arthritic nodosus, lessens tendency to accumulation of tartar on the teeth, gravel, and renal calculi. Next remedy is calcarea sulfurica, that is sulfate of lime, plaster of Paris, eczema and trophic glandular swelling and cystic tumor, fibroids, and then suppurative processive comes within the range of the remedy after pus has found a vent. So calcarea is the remedy which has the pus to be come out. Suppurative process come within the range of this remedy and after the pus has found a vent. Mucus discharge are yellow, thick and lumpy, and lupus vulgaris, it's mainly affection of skin and glandular swelling, cystic tumor, fibroids, and then suppurative process some within the range of remedy. After the pus has found a vent, then mucus discharges are yellow, thick and lumpy, lupus vulgaris, then inflammation of the eyes with the discharge of thick yellow matter, see only half of an object, cornea is smoky, ophthalmia neonatrum. Then cold in the head with thick yellowish purulent secretion, frequently tinged with blood, one side discharge from nose, yellowish discharge from posterior nearest edge of the nostrils. Pimples and pustules on the face, mainly seen, and the herpes. Painful abscess about the anus in case of fistula. Fistula in anus, they can be think of calcarea sulf, burning, itching of soles and feet, relation compared with hepar and silesia. Then the last remedy is calcarea silicata. It's a deep and long-acting remedy for the complaints which come slowly and reach the final development after a long period. Then there will be more of hydrogenoid constitution like natrum self, but natrum self get aggravated whatever thing is growing near the damp place, basement or cellars, this like this. But here it is only mentioned as hydrogenoid constitution, and natrum self is more of liver remedy too. So it is very sensitive to cold. Patient is weak, emaciated, cold, chilly, but worse from being overheated. Sensitive generally, atrophy of children. So they are very sensitive to cold. Patient is weak, emaciated, cold and chilly, but worse from being overheated. Calcarea for subluxation from warmth, but this is also worse from being overheated, but they are emaciated, cold and chilly, and generally sensitive generally. It's not only particular season or thing, they are sensitive in general. Absent-minded, irritable, irresolute, and lacks self-confidence, fearful. So these are the main things. And they are compared with arsenica, then tubercular, barita carb, and iodatum. So I hope you have some idea. I am not sure that you have get a full idea from my lecture, but you can understand something about Calcarea and do well for your examination. Do prepare well and do well, thorough with your keynote and boric, whatever things has been mentioned in italics and the introduction paragraph, the relationship chapter. If you are well versed in that, you can understand easily. Okay. Thank you, everyone. Thank you.